Hi, and welcome back. My name is Robert. I'm a registered nurse, and this next part will entail placing your loved one's medication names and what they contain in both rows and columns. At the top of each column, which goes from top to bottom, you're going to write a word that represents that column. Starting at the left side of the paper and proceeding to the right, in the first column, write the word name. Moving over one, write the word strength in the next column, followed by the word taken in the third column, and ending with the word reason in the final column, equaling 4 columns total. The columns themselves do not need to be the same length and size, but will be equivalent to what's going to be written in them once you finish. Underneath in the first column, under the word name, write the time your loved one takes their first medication. You'll want to darken this so it can easily be seen. Example, 6:30 a.m. In the following row, you would list the medication or medications your loved one takes at 6:30 a.m. But for this example, we're going to pretend your loved one takes only one medication at that time period. The example medication in this scenario is called Synthroid, also known as levothyroxine. It is used to treat low thyroid levels in the body known as hypothyroidism. From this point on, though, the medication printouts the pharmacist gave you, the one you highlighted, should be used for reference for each and every prescribed medication your loved one takes. Under where you wrote the 6:30 a.m. time in the first column, write the name Synthroid, and next to that you'll write a capital B with a circle around it. For attached to this medication list on a following page, you're going to write the word explanation on the left side of the paper and the word instructions on the right side of the paper, or place the word explanation above the word instructions, but leaving enough space between the two for information to be included. Under explanations, which you can underline, write brand equals B with a circle around it. If they were taking levothyroxine, you would write generic equals G with the circle around it. If your loved one takes both brand and generic medications, this is a good way to help you learn which is which. Moving over to the next column in the same row, write the strength of the medication. Thyroid medication is usually written in micrograms. The abbreviation for this is mcg, where most other medications are in milligrams, which is abbreviated as mg. If your loved one has medications in milligrams, which can be more prevalent, on the following page under explanations, you would write milligrams equal mg, and on the next line or next to it, going across, write micrograms equal mcg. So for the strength of the Synthroid medication, the example to be written is 50 mcg. In the same row, continuing moving over one column, write how the medication is taken. In this example, Synthroid is taken by mouth. You may choose to write by mouth or the medical abbreviation PO, which in Latin is per os, meaning by mouth. If you decide to use the medical abbreviation, on the next page, under explanation, write by mouth equals PO. In the final column, under the word reason, write why the medication was prescribed. For this example, keep it simple. Write low thyroid level, but in reality, go by what is written on the pharmacy printout. Keep in mind that medications like Synthroid or levothyroxine will have instructions on the printout related to how to take the medication properly. On the following page, under the word instructions, which you can underline, write what's stated on the printout. Synthroid or levothyroxine instructions for that particular medication may include to be taken first thing in the morning with a glass of water, by itself, on an empty stomach, 45 or 60 minutes before the first bite of food, as indicated by your loved one's doctor on the pharmacy printout. Going downward one row, following that by writing the next time perhaps a medication or medications are to be taken. In this example, 7:30 a.m., it will correlate with the time your loved one eats their breakfast. If your loved one is a diabetic, this may be the time they cover their diabetes blood sugar results. If your loved one is taking a rapid-acting insulin, you would write the name of the medication, which, for example, will be Humalog, followed by a B with a circle around it. In the strength column, write the word unit. Under taken, write subcutaneous or the medical abbreviation SQ. If you choose to use the medical abbreviation on the next page under explanation, write subcutaneous equals SQ, and next to the SQ, write the word in parentheses, small needle injection, in case someone might not understand the meaning of subcutaneous. In the final column under reason, write diabetes, and I would recommend to write next to it in parentheses the letters S period, S period, because on the following page under word explanation, you would write insulin sliding scale coverage equals, in the parentheses, S period, S period. On the explanation instruction page, I would recommend to list your loved one's insulin sliding scale coverage to be followed, placed above those two near the top of the page. Under instructions, I would clarify further that subcutaneous injection coverage, for example, are to be placed in the back of the upper arm and rotated between the back of the upper arms with every additional coverage, or given in the abdomen as instructed by their doctor. Please review with your loved one's primary doctor or endocrinologist if they're the ones who prepared the sliding scale coverage for your loved one's diabetes blood sugar results. If your loved one, in addition, takes at the same time or instead a long-acting insulin, such as Lantus, also known as Glargine, on the next line pertaining to this example, write Lantus followed by a B with a circle around it. Under strength, write the amount they're to take, example, 15 units. Then moving over, under taken, write SQ if you decide to use it's a medical abbreviation. And underneath reason, a choice can be is diabetes long-acting insulin, or as previously stated, write that which is written on the pharmacy printout. The next example time will be 9 a.m. If your loved one is to take multiple medications, say at 9 a.m., and if one does not have to be taken before the other, a suggestion is to place them in alphabetical order. In this example, one of your loved one's medications will be an eye drop. Write the name of the eye drop in the name column. Under strength, write 1 drop or the number of drops to be used. Under taken column, write left eye, right eye, or both eyes as per order, followed by why it's being taken under the reason column. Examples, cataracts or glaucoma. If your loved one takes multiple different eye drops in the morning, what may be listed under the instruction part on the next page is the order upon to be given and the amount of time needed to be separated. An example is to write the name of the eye drop medications, indicating which comes first, and a statement similar to eye drops to be separated by either 5 or 10 minutes apart. Please review with your loved one's primary doctor. If your loved one uses a nasal spray in the morning, write the name of the medication, 1 spray or the number of sprays to be used, left, right, or both nostrils, and the reason it was prescribed. Ear drops would be the name again, 1 drop or the number of drops to be used, left, right, or both ears, and again, the reason it was prescribed. If it is a medication that's placed under the tongue, write the name of the medication, the strength, the word under tongue, or the medical abbreviation for which is sublingual, which is SL. Then write the reason. If you plan to use a medical term, on the next page under explanations, write sublingual equals SL, and in parentheses next to it, under tongue. If it is a medication to be chewed, indicate that under the taken column. If half a medication is to be given, for this example, Coreg, also known as Covedrol, which is a heart medication, under name write Coreg followed by a capital B with a circle around it. Under strength write 12.5 milligrams. Under taken write by mouth or PO. And under reason write as may be stated on the pharmacy printout, for example, chronic heart failure. But next to that write 25 milligrams scored to equal 12.5 milligrams. Under explanation, write cut in half equals scored. To score medication in half, the medication should have an indentation line across it called a score mark, and to cut properly, a pill cutter should be used. Under instructions, you would write Coreg 25 milligrams, whole pill is scored in half using a pill cutter to equal 12.5 milligrams to be given. An additional note you can write is afterward, place leftover Coreg half medication pill back in Coreg medication vial. That way the extra piece is not thrown away and can be available for future use. An additional thing you could do, since you know your loved one will receive only 12.5 milligrams of the medication when to be given, is to go ahead and score all the medications in the Coreg pharmacy vial for less confusion. Please review with your loved one's primary doctor or cardiologist if this medication was prescribed and if it is to be scored in half before being taken. Coreg is a good example of a medication that can be given twice a day. So if the next time Coreg is to be given is at 9 p.m., you would write Coreg out again with the understanding to write out only those medications that are to be given at that particular time. If a medication is to be prescribed more than once a day, on the explanation and instruction page, down the left-hand side towards the bottom, write the word times, which can be underlined, and below that you would write Coreg taken twice a day at 9 a.m. and 9 p.m. So any prescribed medications your loved one takes more than once a day, place under the word times and list those medications and the times it is to be taken. If there is a prescribed medication that is taken only once a week or once a month, after leaving a row blank, write that day of the week or a selected date, for example, the 15th of every month, and below that write the name of the medication, strength, how taken, and reason. Under instructions, on the next page, write a short detailed description about the medication, restating the exact days or date it is to be given so it's not missed. Once more, we're going to take an additional break, so please stay tuned for the following.